Hi everyone, it's Dr. Kim. It's Saturday morning. I'm getting set up here to do a suture facelift. So a suture facelift is different than a surgical facelift, and it's important to understand the differences between the two. So first of all, a suture facelift is not going to give you the same degree of lift or last as long as a surgical facelift. So it's not a direct replacement. However, there's also no incisions, no scars, very minimal downtime, and financially a lot less of an investment than a full surgical facelift. So that's point number one. So what is a suture facelift? Well, it uses PDO sutures, which are basically dissolvable stitches. So PDO sutures have little barbs on them, or quills. And I have been using them for at least 10 years now in order to sew up tummy tuck incisions and actually during my surgical facelifts as well. This suture has these little barbs. One of the brand names is actually called Coil Suture. And those little barbs hook into the skin tissue and really hold quite strongly. So I started using it in my tummy tucks where we really need a nice strong closure to that incision. So when we're using that same suture for a suture facelift, we're threading that suture underneath the skin into that deeper layer of skin to lift and pull, and counting on those little barbs to basically hook in, hold the skin, and lift and pull it back up into position. There is no stitch end sticking out at the end. They're all buried underneath the skin. And it's only done under local freezing, so you don't have to have a full sedation or general anesthetic like you do for a full facelift. PDO threads or PDO sutures have been approved in Canada for a really long time. We've used them in the OR, we've used them for surgery for years and years and years. Like I said, I think I started suturing closed my tummy tucks with them in like 2009 or something. So this is a well-studied suture material. It's been used in surgery for a really long time, very well-known safety profile. Dissolves away over about 6 months, and the tissues are healing up in that new position while the stitches are dissolving away. So that's what I'm getting set up in here this morning. We do have to do it sterilely, of course, because the stitches are being put underneath the skin, which means we use full surgical prep like we would. Sterile field, your hair has to be tucked up away off your skin, sterile gloves, the whole thing, similar to setting up to do a surgical procedure, but less invasive, less downtime, no scars. So if you have any questions about PDO thread lifts, make sure to send them in.